Hi there. Today we are going to be presenting a unique case which stresses the importance of good communication and taking a patient's history. Cardiac arrhythmias with a twist. This is Jane. Jane is a first-year engineer and she just failed her first physics quiz attempt. Jane is very stressed. Jane loves licorice. She begins to stress eat licorice while she studies. Soon, she's eating over 100 grams of licorice every day. Jane is writing her second physics quiz attempt and brought her licorice to get her through the test. Once Jane is finished, she hands it in to the professor. Let's see how she did. After finding out she failed, Jane begins to feel even more stressed. Her heart starts pounding, she begins to sweat, and she feels very lightheaded. Jane returns home and continues her routine of studying and stress-eating licorice. Jane is now on her last physics quiz attempt, and she's hoping her licorice will bring her some good luck. Jane finishes her quiz and goes to hand it in to the professor. Let's hope she did better this time. Jane is so relieved that she finally passed her physics quiz, but her heart is still pounding, she is still sweating, and she still feels very lightheaded. Jane goes home to celebrate passing her physics quiz and rewards herself with her favorite snack. However, her symptoms persist. In fear she may pass out, she decides to call an ambulance. Once Jane arrives at the hospital, the doctor notes her symptoms and questions if she has been feeling stressed or has any family history of heart disease. After taking a look at the ECG trace, the doctor concludes that Jane has ventricular tachycardia caused by hypokalemia. With no family history of heart disease, the doctor was unable to confirm a cause, but suspects that it may be related to Jane's stress. Following her treatment, Jane's symptoms were resolved and she is released from the hospital. A week later, Jane attends her friend's party to celebrate being done the semester. Of course, she brings her favorite party snack, licorice. As the night goes on, however, she begins to feel faint. Before she can sit down, she falls unconscious and is rushed to the hospital. When Jane returns to the hospital, the doctor is concerned as her symptoms returned even though she was no longer stressed. He begins to suspect other causes. After further questioning, the cause of Jane's heart issues are finally revealed. So how does licorice lead to arrhythmia? A compound in licorice inhibits 11-beta dehydrogenase, which converts active cortisol into inactive cortisone. By inhibiting this reaction, we increase the levels of cortisol in our body. Cortisol acts on the collecting duct in the nephron. This increases the excretion of potassium, leading to lower levels in circulation. Action potentials in the heart begin with sodium ions leaving the cell, causing depolarization. Potassium is an essential component of the repolarization phase to return to the resting membrane potential. In someone experiencing hypokalemia, the repolarization phase is prolonged. This will cause an early after depolarization. And this is why licorice leads to ventricular tachycardia. After the doctor informed Jane of the cause, Jane decided to get rid of her licorice and search for a new study snack. This case is not only unique, but emphasizes the importance of patient-physician communication to ensure optimal patient care. Thanks for watching.